Medical practitioners in Lagos converge on GRA Ikeja for the official launch of the Ilera-Eko emergency services.
Today marks the beginning of a new dawn in the health insurance space.
The Lagos State Health Management Agency, which is championing universal health coverage in the state, is here to institutionalize emergency medical stabilization for insured and vulnerable residents under the Lagos State Health Insurance Scheme.
I am pleased to say that as we gather here today, all key stakeholders, hospitals, ambulance service providers, regulators, and our internal emergencies team have been duly sensitized and are ready to kickstart LASHMA-Aid. You would, of course, want to know that our scope of coverage extends to 48 hours of in-facility treatment necessary to stabilize active Ilera-Eko enrollees as well as vulnerable residents. LASHMA-Aid is not just about ambulances and approvals. It is about saving critical minutes and preserving lives. It is about ensuring that in moments of crisis, our Ilera-Eko enrollees and the vulnerable of Lagos State are not left unattended to due to financial barriers, confusion, panic, or fear, whether at the scene of an emergency, at home, or even in the office. Our swift response can protect their lives, as the adage says, a stitch in time saves 9.
Come January, it will be very mandatory that you have a social health insurance at the least. And we don't want to use any form of coercion, but it will be a carrot and stick. The governor has mandated that we make this happen. So we are relying on everybody to come along and support the cause.
The government says LASHMA-Aid will serve as a landmark intervention in safeguarding lives during medical emergencies.
With the introduction of LASHMA-Aid, every public servant, irrespective of cadre, duty, post, or location, together with their families and our pensioners, now have the assurance that in moments of emergency, help will come promptly, professionally, and without the burden on financial hardship. We no longer need to panic or run from pillar to post in search of funds during medical emergencies. This is the true essence of responsive, compassionate, and people-centered governance.
The Lagos State Health Scheme Law, LSHS law, enacted by the Lagos State House of Assembly, was designed to ensure that all residents of Lagos State have access to quality health care without undue financial hardship. LASHMA-Aid stands as a clear, practical, and impactful expression of the objectives of this law, translating legislative intent into decisive life-saving action.
The Special Advisor on Health, Dr. Kemi Ogunyemi, explains that with LASHMA-Aid, residents can access emergency care through the universal emergency numbers 112 or 767 or the dedicated LASHMA toll-free line to prevent sudden death.
The launch of LASHMA-Aid has clearly demonstrated that LASHMA is truly prepared and ready to provide emergency medical support to Ilera-Eko enrollees and the vulnerable, as well as improve medical emergency services in Lagos State. This is also a testament to achieving universal health coverage in Lagos State. Our workforce expansion process, following Mr. Governor's approval, will commence early next year with the employment of 60 nurses who will provide critical medical care to patients in emergency situations and 20 bike riders who will support emergency response efforts. I hereby launch LASHMA-Aid.
The launch of LASHMA-Aid marks another strategic step by the Lagos State government towards strengthening financial risk protection, improving access to emergency healthcare services, and advancing universal health coverage for all Lagosians.